Hi, welcome to Pulamed. Today I will be teaching you on how to write notes for your theory paper. So the example here will be acute pancreatitis. Let's proceed. Here comes the burning question. Is this video really for you? If you are an MBBS student, yes it is. If you are a MD postgraduate student appearing soon for the exams, yes it is. If you want to make a note on acute pancreatitis, then also this is the video for you. Before going into actual topic, let us have some clarity on how to make a note. So first thing we need to answer is how many sides of the page should notes be? I already mentioned in my earlier video in the playlist that a note should mimic your exam answer sheet. I am very much sure you must have already bought your ruled notebook of 25 lines or plus for each side. So first thing is the number of sides of the page should be at least 4. This is very much important because you can't expect someone to give you just 10 marks for the two sides of the matter you write. Underwriting or overwriting will have some effect. Underwriting, yeah, likely that you may get less marks. Overwriting may be not going to be of much benefit. I will tell you my practical example, which I had earlier when I was writing my PG theory exams. What I have done is I have written 6 sides of matter. Every question almost, except 2 or 3 questions, which I ended up writing 4 sides. One of the friends, he wrote 4 sides of matter. For each question, he didn't write one side excess or one side less. And he had lot of time. He just sat idle. So I asked him once the exam is over, why are you sitting idle? You could write one more side. He told me, no, Dheeraj, it's fine. 4 sides are enough for passing. I don't think an extra side is needed for me to pass. When the result came out, he scored 8 points extra than me in theory exam. The concept is very clear for you now. The number of sides is 4. Under or over is not going to make any difference. Rather, we say the quality of the answer is the thing that matters most when examiner is correcting your paper. Saying that, I'll go with respect to handwriting now. Beautiful handwriting might fetch you marks extra, but it will also kill your time. So, as long as the answer is clear, legible, with approximate size of the letters, it shouldn't be a trouble. So, next comes, do diagrams matter? Yes, they do matter because one thing I can say definitely is a diagram will explain the knowledge you have more than 10 points you write. I suggest you draw diagrams wherever it is possible. The diagram have to have a good outline, that's it. Do flowcharts matter? Yeah, they also matter a lot. The main concept of flowcharts and diagrams is to make your answer expandable. Sometimes you know very little. In case you write it in flowcharts, then it's going to be much benefit for you. Next thing is it supposed to be in paragraphs or points? I suggest go with points. If it is a paragraph, teacher wouldn't have that much time to look it into a with a greater detail, and maybe they think to give you an average mark for that answer. So it's better you write it in points if it is a good answer which you can confidently write. If it is something you do not much sure, maybe writing in points might put you at risk. You can go with paragraph. Adequate spacing is one more thing that is important. It just need to be adequate. If you are going to give over spacing between the lines, between the points, you just make it obvious that I do not know the answer, so I'm going to write it with so much space between the lines. That gives a very bad impression. So make sure the spacing is adequate enough to just ensure that your answer looks clean and neat and seems organized. So let us dive into acute pancreatitis. First, it should be an introductory point, one or two, like for example, most common disease of pancreas. Then definitions, like acute pancreatitis, it should have at least two of the three. One is classical symptoms, sudden onset, epigastric or left upper quadrant pain. Second is going to be elevation of serum amylase or serum lipase greater than 3 times upper limit normal. And third one is going to be radiological imaging consistent with acute pancreatitis. Then what is recurrent acute pancreatitis? Two episodes or more separated by 3 months gap is what we call as recurrent acute pancreatitis. Let us dive into etiology. We'll be writing few points on etiology. Let's say gallstones, alcohol, hypertriglyceridemia, hypercalcemia, ascariasis, post-ERCP, pancreatic neoplasm, paracetamol poisoning. We are done with page 1. Now coming to page 2. So in page 2, we are going to start with pathogenesis. This one we will be writing in the form of flow chart. So you write the sentence, give a vertical arrow that occupies 3 lines at least, and then write another sentence. So it goes this way. So initially the insult, then we are going to have conversion of trypsinogen to trypsin. This favors activation of proenzymes and this causes autodigestion of pancreas. Then coming to clinical features, symptomatology. So initially the person is going to have sudden onset epigastric pain, which will be radiating to back and it will be relieved on sitting upright and leaning forward position. Then the patient can also have nausea, vomiting, anorexia, and also fever. So these things you are going to mention. Next coming to signs. In signs we have sinus tachycardia, epigastric tenderness, abdominal guarding, the upper abdomen, decreased bowel sounds, and then in hemorrhagic pancreatitis, we can have Gray Turner sign, which is a flank ecchymosis, and periumbilical ecchymosis, which is called as Cullen sign. So, how do I remember is Great Turner, so turning. That's why it will be in the side flank. So that's how I remember. You can also remember it that way. And using this terminology is also very important because it gives an impression to the examiner that you can use some advanced medical terms. In page 3, let us discuss about complications. Local complications first, that is fluid collection, necrosis, pseudocyst, then bleeding. In case the inflamed pancreas compresses bowel, then bowel obstruction, otherwise fistula formation. These things can be there. Once this listing is done, take the opportunity to draw a diagram depicting a local complication. Like for example, I have taken here pseudocyst. Just draw an outline of pancreas and also an outline of pseudocyst on the pancreas. That should be sufficient. This diagram itself has potential to fill half of your paper or at least 10 lines of your paper. So that's why this is really important. You depict the diagram and neatly label it. Then comes systemic complications. How I usually remember is organ wise. I go with encephalopathy, ARDS, liver failure, renal failure, then DIC, partial retinopathy, and also metabolic complications like hypocalcemia, hyperlipidemia, hyperglycemia, hypoglycemia. So that's how I remember, and that's how I write. I suggest you do the same system wise. This much we have discussed just for this page 4 content, that is nothing but Atlanta classification. So we divide it into categories: mild, moderately severe, and then severe. But no one fails you if you just remember moderate. Okay. So don't stress yourself on remembering it as moderately severe. Mild is like no complication and then no organ failure. Moderate is like less than 48 hours of organ failure or a systemic complication or a local complication. Then severe is like persistent organ failure or Ranson score greater than 2, Apache 2 greater than 8. So this is how you are supposed to write, and that also gives a good impression. You just took the examiner from describing everything just to take him into this Atlanta classification, which is giving him clarity. So this is really important. Then comes investigations. CBP increased leukocytosis, serum lipase, serum amylase, serum lipase being more specific compared to amylase. Then ultrasound imaging to identify any gallstones. Even you can go with radiological imaging like CT in order to calculate CT severity index, Balthasar grading. This writing of Balthasar grading is very important, at least you name it. But writing the entire grading is really cumbersome. It's very difficult to remember. If you can do it, okay, go ahead, maybe a distinction or two. But for passing, it's not much of a benefit. Now I went to page 5. I already mentioned you earlier that page 4 is sufficient, but still I mentioned page 5 because it is natural for us to forget few things from previous pages. So having a one slide extra for page 5 is like a safety net. You can just have it, and in case you need points which miss there, you can add these points and build the answer. So we have for treatment, that is general treatment, where we keep the patient nil per oral. We start him on IV fluid, right, ringer lactate, and then oxygen to maintain SpO2 greater than 90, pain control tramadol, as well as in case there is elevated bilirubin, then we go with ERCP. And for necrosis, we can do necrosectomy and antibiotic administration. For specific treatment, you can go with cholecystectomy in gallstones, and you can also go with statin therapy in hypertriglyceridemia. It was so nice for you to tag along. Thank you very much for that. I suggest you comment on what more videos I should make pertaining to sample notes. And I'll be creating a separate playlist for sample notes. But this video will be posted in the theory tips playlist only. So in the sample notes playlist, what kind of notes you would be wanting to have, do comment in the comment section. Do subscribe to my channel. I think I'll see you again. But before that, I also want to emphasize that the video brought here for you, it is only for training you to make a good notes. My notes cannot replace your notes. That is what I want to tell you. All the best for your exams. Thank you.